Hey, good morning. Summer's in full swing. It has been for 6 weeks here. Many of us are spending a lot of time outdoors when possible, and every time we do, it puts our skin at risk.
Yeah, according to skincancer.org, at least 1 in 5 Americans will develop the disease by age 70. Cosmetic surgeon Dr. Adam Scheiner joining us this morning to talk about the dangers the sun can cause, the dangers of the sun, and new advancements, doctor, in technology helping to counteract that damage. Thanks for being with us this morning.
Thank you so much for having me.
Absolutely. Let's get right to it. Most people know that exposure to sun can lead to skin cancer, but how much exposure are we talking about? Is it different for everybody? What do we need to know about this?
You know, when the sun shines down on the earth, it's composed of multiple wavelengths of light. Some are visible, allow us to see one another, and others are invisible. Most important among these are the ultraviolet or UV wavelengths. UVC, UVB, UVA. UVC is absorbed by the ozone, thankfully. UVB is a wavelength that makes our skin red, B for burn. And UVA is a long wavelength that can penetrate deep in the skin where it fractures elastic and collagen fibers, allowing our skin to sag and droop. A for aging. It's actually present all day long and can even penetrate clouds and car windows. These UV rays can bind together parts of the DNA in the lower part of our epidermis called the basal cell layer, and it creates something called thymine dimers, which makes the cells irregular, leading to basal cell and squamous cell skin cancers. Interestingly, in the 70s and 80s, sunscreens came about, which allowed us to stay out in the sun longer without getting red because it was blocking the UVB rays, but we saw skin cancer rise. And this is because it was blocking just one of the dangerous UV rays. It was blocking UVB, so we could stay out longer, but we're getting a full dose of UVA unimpeded. And recently, we do have ways to protect our skin against UVB and UVA. These are using things such as titanium dioxide and zinc oxide. These are mechanical blocks that work immediately when they're applied to our skin and are safe for the reefs in the ocean.
Oh, and these come in different forms, I guess, for us to use? Creams, or how do they come?
You know, they come in creams, and you're looking for ones that say they're titanium dioxide or zinc oxide.
Okay.
Okay.
Now, what about some new technology and advancements in removing sun damage? I mean, protecting it obviously is most important, but if it is damaged, now what?
Absolutely. There's a medication known as Retin A that's been out for a long time that can reverse some of the damage. There's a company called Cyton that made a device called Broad-Based Light Forever Young, and it's a light treatment that actually has been shown in studies done at Stanford that can reverse sun damage without a lot of downtime. And then I have a procedure I call Reset for Sun Damage, where I can actually remove years of sun damage for patients.
I'm writing all of this down because I need a visit. Doctor, how does the laser procedure you use help remove precancers and early skin cancer?
Most of the damage from the ultraviolet rays is to the top layer of our skin, lies in the basal cell layer. When I use a laser to treat the skin, I actually remove this layer and all the damage above it. When the body regrows the skin, it regrows with brand new cells that have never seen the sun before. It improves the appearance of the skin with tighter skin, new collagen, new elastic fibers, and the health of the skin, where it removes precancers and some active skin cancers as well. That's why I call it Reset for Sun Damage.
Wow.
Is there a direct correlation between sun damage, the way it looks to us, and maybe skin cancer? In other words, if I look at my skin, I'm thinking, boy, I have a lot of damage. Am I just automatically at a higher risk?
Sure. There are things, you can have flaky skin lesions on the face and chest called actinic keratoses. 10% of these will go on to form squamous cell carcinomas. There are lesions that have rolled pearly edges, and these are suspicious for basal cell carcinomas. And then there are melanomas. These are the most dangerous. Those are the ones that tend to be lethal. They're usually, interestingly, in non-sun exposed areas. And for those lesions, you're looking for a pigmented lesion that has asymmetry to it, that has an irregular border, that has different colors, and has a diameter that's greater than 1/4 inch.
And if you're not seeing anything right, let's say you haven't had a sunburn since you were in your 20s and you're, mid-40s like we are, you still are at risk for developing melanoma. I feel like there's a disconnect. Oh, I haven't been in the sun in years, but the damage can come back to bite you decades later.
Very, very true. And that's where we're talking about those modalities I was talking about before. The Retin A, the Cyton, Broad-Based Light, Forever Young, and then the Reset procedures can all help to counteract that.
And how often should we be seeing a doctor to get our skin checked?
Usually once a year is good, and if they think that you need to see someone, see themselves more often, they'll let you know.
Okay. Do you recommend a spray sunscreen, lotion? Are there better things to apply, one versus the other?
Well, really what I was saying, the mechanical blocks, titanium dioxide and zinc oxide, these reflect the light immediately. They work immediately when they're on the skin, where they do have some that are in spray, that's fine. Yeah. But the active ones are really being, they're really being taken out of the market. Right now in Hawaii, you cannot use anything but these mechanical blocks because the other ones, those other certain sprays that they had actually hurt the reefs.
Interesting, right? You got to keep that in mind. Cosmetic surgeon, Dr. Adam Scheiner. Thanks, Doc, for your time today. What's a website folks can go to?
Thank you so much for having me. You can put adamscheinermd.com or just look up Reset for sun damage.
Perfect. And we love that live on air sign behind you. We want one of those.
Thank you so much.
Have a good day, doctor. Thank you.
You guys have a great day.